Hey guys, this is Manu Kalia, physical therapist and Ayurvedic herbalist. I'm going to show you a technique for improving the mobility of the IT band. It's a treatment technique for IT band pain or syndrome. And just to review, IT band is that thick band that goes along the outside of your thigh, and it'll attach just below the knee on this area on your shin bone, your tibia, on the upper part of it. Okay, and most of the time, people will complain of pain on the outside or lateral side of the knee along this region. It could be further up too, but most of the time, the complaint of pain is right around this area. Okay, it's most common in runners and people who do a lot of biking. But contrary to popular opinion, it's not a friction syndrome. Okay, so the bending and straightening of the knee does not cause the IT band to rub back and forth on the bone, causing a friction and inflammation or irritation. Okay, the the band itself is part of your thick connective tissue and myofascia, which attaches layers of around the layers of muscles. Okay, all along your thigh. So it's too thick, and it's to be able to move back and forth, as what the contrary to popular opinion, as I said. So the issue is more of compression, okay, and irritation of the fat pad as well as the connective tissue that's underneath the IT band. That's where the irritation is taking place. Because it's too tight, it's causing compression and irritation in a lot of those structures. Okay, the fat underneath the IT band, it's highly vascularized and also innervated. Okay, so irritation to that and the other surrounding tissues is what causes all this pain along that region, as well as the band fibers themselves too might get inflamed and thickened. So a lot of that pain that's coming there, we want to work at improving the mobility of that tissue. Okay, we want to improve circulation. We want to remove any thickening or adhesions that have formed along that region. Okay, free up that tissue so it moves a little better. There's less compression through there, and for that we're going to use cups, cupping techniques. So you see in some of my other videos that I've done, we use cups for quadricep tendinosis or tendonitis issues, patellar tendon issues, and it can be used for lots of other things. So cupping treatments are very effective, traditionally used in Chinese medicine and in other Eastern medical systems also. So their cups are really effective to improve circulation, to remove blockages, and just promote flow of blood flow and other lymph and other fluids to move through that area, okay, an injured area. But the other reason we are using it also is because the suction that's created with the cup, we can help separate layers of tissue, do some myofascial stretching too, and free up a lot of that tissue, and which is very difficult to do with my hands. I can't really grab a tissue and separate it this way. Okay, and remember, the IT band is too tight, it's too stiff. You can't really stretch that band. It's very thick. So a lot of the stretches that you see after people trying to stretch that band, you can't really stretch that tissue. You can stretch the surrounding tissues around it further up in the chain, but the actual band, the fibers is just too thick, and you can't do that. So we are going to use, I'll show you different size cups that I have here. Remember, you can go all along this region. So the first thing you can do is just to kind of, and I applied a little bit of oil, herbal oil or some other oil you can apply there so the tissue, so it glides a little bit better. So one of the simpler techniques, first thing we can start with is, as you can see, I suction and I pull that skin tissue, gets pulled straight up. I can work at gliding that back and forth, different parts of the thigh, okay? And you can tighten it to tolerance. So again, I tighten it up. I can leave it there too, but I'm going to do just some movement back and forth here to kind of free up that tissue, various layers of tissue, do some release. And also that pulling it back and forth also promotes some circulation in that area. Okay, so remember, even though I'm having pain here, I'm still going to work at freeing up tissues all the way up through here, because that's going to impact what happens down here too. So that's the first part, just to go along there to free that tissue up. Second thing we can do is then get more specific. So this region just below the knee, out on the outside through here. I'm going to suction to tighten up. Now there's a good amount of pull going through that. Cup. Next one I'm going to do is I'm going to go up to the next level. I'm going to tighten that up. Again, it's to tolerance, okay? And finally, the last one we're going to do is we're going to go up through this one. All right? So you can see it's got a pretty good pull on that. All right? And when I can leave it there for about 5 to 10 minutes. When I release, I'm going to pull this down, and you can see how it gets a little bit of that redness through that area. Okay? So, hope you found that helpful. Number, no more than 5. Start with about 5 minutes, 5 to 10 minutes maximum, okay? And you want to make sure you're not doing these on open skin, okay? Or if you have increased sensitivity of the skin, your diabetes or some other issues, you want to avoid, or the skin is really fragile, someone who's elderly, you don't want to do that cupping there either. Now, no more than about 5 minutes initially. You can go up to about 10 minutes or so, leaving that cup there, okay, to tolerance, and see how it does. And you'll really find it to be very effective. It'll free up all that tissue through here and really help improve mobility of that tissue, promote circulation, and help with getting that IT band issue under control. So I hope that you found that helpful. Leave a comment if you have any questions. Subscribe to the channel, and click on the link below to check out my site. We have tons of information on it, and we've got a pretty amazing product that's going to be coming up soon. So make sure you keep checking the site for that. It's for runners and athletes dealing with all sorts of injuries. All right, thanks guys.